Treatment of acne is not like one size fits all. It is a customized process depending upon your severity, skin type and also the root cause. It all starts with routine care. First you have to use any foaming face wash containing glycolic acid, salicylic acid that helps in controlling the oil and also it has some exfoliating action. Don't forget to use moisturizer. Better to use light moisturizer to protect the skin barrier and also use sunscreen, preferably gel based. All these things will protect your skin or maintain the skin barrier. And any prior treatments, your lifestyle, diet, sleep, any hormonal imbalance, and if needed also we do some basic blood tests to rule out any underlying hormonal abnormality. Depending upon the stages of acne and severity, treatment is broadly divided into topical and systemic. Topical treatments like anti-inflammatory, benzoyl peroxide and some antibiotic creams, and sometimes topical retinoids helpful, especially if you have mild form, if you have any mostly comedonal acne. But once you have a severe form like pustules, nodule or cystic lesions, in that case we prefer systemic agents over topicals. And those who have a tendency of scarring and also those who have a family history of having prolonged acne or severe acne, in that case also we used to start systemic medication in the early stages. Other than medications, there are other factors like lifestyle modification is also play an important role in management of acne, especially those who have late onset acne, those who have hormonal acne. It has been found that any form of diet like with high glycemic index, refined sugar, refined carbohydrates that contribute to weight, and also it has a role in terms of hormonal imbalance. So if you are already having acne and you feel like you are taking treatment still is not getting clear or it is persisting, then you must work on your lifestyle modification in terms of weight reduction, regular exercise, control your diet, avoid high glycemic index diet, also avoid any form of diet that will lead to weight gain. Stress management, adequate sleep and good hydration also help in healing the acne from within. Once the acne is controlled, sometimes the pigmentation or the marks is stubborn, or if you want to have a first result and also to get rid of this pigmentation completely, then we may have to plan for some procedures. The common in-clinic procedures like chemical peel for the pigmentation, and sometimes we also plan laser and light therapy like fractional CO2 laser, IPL for the post-acne erythema. So these all helps in improving and also having early clearance of the pigmentation. There are certain lesions of acne like comedones. They are mostly resistant to medical management, so we may need few sessions of comedone extraction. So these are steps of procedures along with medical management help us to complete clearance of the acne and post-acne sequelae. For the post-acne scar, the medical management is not usually effective. There are various types of acne scars like ice pick scars, box scars and rolling scars. So depending upon the type of scars, we have various treatment options like subcision, PRP, microneedling, MNRF, fractional CO2 laser, and sometimes if the volume loss is more, then sometimes also we plan fat grafting to compensate to correct the volume loss. And if you are having very severe grade of acne like nodulocystic acne, it sometimes needs some injection and also incision and drainage of the content inside the cyst to have a complete clearance of this type of lesions. Once you have a control of the acne, then comes the role of maintenance phase. You have to be on regular routine care like taking care of oily skin like use of foaming face wash containing salicylic glycolic acid, avoid any thick products that may clog your pores, avoid putting hair oil, don't use any thick products that will make your skin more oily. So if you are having acne, it is completely treatable if you will intervene early with proper diagnosis and in the proper staging with proper treatment. Definitely it is possible to get rid of the acne and acne related issues like erythema, pigmentation and scarring. We can treat it completely.